the fact about MUFA, you did say that MUFAs would help in diabetes. Now, of course, in intensive care unit, I don't see there much of a change when it comes to MUFA. But what do you feel? How does MUFA really help to reduce, or for that matter, improve glycemic control? How does that do that? How do they do that? Because what I understand is, as Sir also said, as you also said, MUFAs are also added, or higher amounts of MUFAs are there in these diabetic specific formulas. How do they do? How do they work?
Actually, there is no formula which can be said to be perfect. What happens in the critical care unit is we do have non-diabetic, diabetic specialized formulae. It depends on the type of patient and the requirement of the patient. So if the diabetic patient is doing well with a generalized diabetic formula, the blood sugars are getting controlled and my target is met, it's fine. But very often what happens is that we do not stick to one particular formula. We combine 2 or 3 together. So MUFA in isolation, we cannot give because of normal food that we give to patients through the kitchen feed or through normal diet. It's very, very difficult to meet the MUFA requirement. Indian foods are not high in MUFA. The ONS products that we have, they have MUFA, and we have plenty of studies saying that instead of refined carbohydrate, if MUFA-rich diets are given to diabetic patients, the sugars come under control. So we are talking about people in the ICU who are already stressed out, who have chronic inflammation. So MUFA can probably do something about the inflammation as well, bringing down the inflammation. But then again, there is not one formula that we use. You have to combine 2 or 3 probably, or shift if required, in order to target, because nowadays we go for precision nutrition. So it's a very patient-centric case. Correct. So depending on the patient's requirement, we might have to change from time to time. But usually the purpose of MUFA, it does help to bring down, theoretically at least, to bring down the inflammation. And that's our target in the...
So correct. So when you look at Spanish studies, when they specifically look at Spanish studies that come from Professor Alejandro from Spain, I mean, phenomenal studies they have done when it comes to diabetes and this particular entity on MUFA. So what happens with monounsaturated fatty acids is we normally these diabetic specific formulas have more than 20% of calorie content that comes in from MUFA, and it does appear that at least in animal studies that it actually increases insulin secretion, it actually increases GLP-1, and it actually thus also, apart from improving glycemic control, it also improves lipid metabolism, as you rightly said, and causing a reduction in inflammation. And as we know, diabetes is related to endothelial damage, is related to inflammation, and that is the one that causes most of the stroke, cardiovascular distress, and the metabolic syndrome that comes in. Correct.